Welcome to the Man Cave Podcast with Dan Casper.
He is Dr. Austin Crowe, Chippewa Valley Orthopedics and Sports Medicine for our Inside the Training Room segments. Good morning, Austin. How you doing, buddy?
I'm doing fantastic.
Hey, because we've had a couple people ask this, that it's already kind of, something you and I have talked about, but a couple people had asked Achilles injuries.
Yeah, I've heard of them.
Yeah, right? I mean, holy moly. I asked you the other day, I'm like, it seems like it's an epidemic going on right now, but, one texter, Tim, said, I'd be interested in hearing from Dr. Crowe if Achilles injuries seem to be more prevalent now than they have been in the past. If so, why would he think that? So, I mean, because I was even Googling that. I was like trying to find 90s NBA players who had Achilles injuries and such. And do you feel like it's more prevalent, or is it just because it's social media and maybe it's out there more, or what's your thoughts?
Probably a mix. I mean, to my knowledge, there's not a good study that's shown that there's a real change in the prevalence of Achilles ruptures. But, I mean, certainly I think clearly it's happening in some of the biggest names, and that draws more attention, right? So that right there is going to create some buzz. So I think it's the social media attention and the names of the players that it's happening to. That being said, I mean, it wouldn't shock me. If you look at what our athletes are doing, there's obviously there's always that generational debate about who's the best athlete, whatever. But I think we cannot argue with the fact that athletes are getting bigger, faster, and stronger. I mean, that's simple facts. I mean, you just look at what human beings on the court or baseball field or football field, whatever it may be, they are bigger, faster, and stronger. And so at the end of the day, you're probably going to see a slight uptick just related to that. I mean, the stress that they put across their body, there's going to be some negatives that go along with it. So I'm sure that's something that'll be looked at. So, it's interesting. I mean, orthopedics, there's studies that'll look at that come out just on professional sports. So probably someone will release a study, and I'll keep my eyes peeled for it. But to my knowledge, not a huge change. But again, like I mentioned, there could be some factors that are creating a slight uptick. But I think, again, to me, it's the fact that it's who it's happening to, like Jason Tatum, things like that, in the playoffs. I mean, that draws a ton of attention to it. Rogers, I mean, the list goes on and on of some of the big names that have happened to recently.
Yeah, even like Tiger Woods, with the Achilles there too. And I don't know if this is a thing, but when I was watching like Tatum's injury and such, does like footwear factor into it at all, or not really? Like the sneakers. I mean, do they have to have high tops or anything like that?
Yeah, I don't see that making a big difference. I don't. I mean, the mechanism, I think, you and I were texting after the injury, and I mean, you can see the video. He plants his foot, drives forward, and so as he's driving forward, the ankle is, we call it dorsiflexion. So it's basically pulling the Achilles tendon apart. So it's called an eccentric load. So that is the classic mechanism. So, I mean, if you watch them 9.5 times out of 10, it's that exact mechanism. They're explosively loading the leg while it's getting pulled apart, if you will. And that eccentric loading is how these ruptures happen. So, bam, you see it. And then it's again, in his, I mean, it wasn't quite like HD, like Rogers. I mean, you could see his like calf do that recoil.
Yeah.
With Tatum's, you didn't quite see that as much because the video, at least the video quality I saw, wasn't as great. But the mechanism alone, it was like, that's what it's going to be. So, to me, it's really more, again, the simple physics of it, right? As athletes are getting bigger and stronger and they load that Achilles, especially in that eccentric load, I mean, it just, at some point, it exceeds its ability to handle it, and bang, there you go, and they have yourself a ruptured Achilles. So shoe wear, probably not a huge deal, more so the physics that they're putting their body through.
With Achilles injuries, is it similar to when we've always talked about ACL injuries and time of return? Because when I was trying to find, some players in the past that tore Achilles, Kevin Durant was like, what did it say, like 16, 14 months, or it was quite a bit for his return. Kobe was like 8 months and such. So I'm like, is that similar to like how we've always talked about with ACL injuries? Like, not everybody's Adrian Peterson who could come back right away and win an MVP, right, essentially?
Yeah, I mean, absolutely. I mean, recovery from all injuries, there is variability, right? And there's a lot of factors that go into it. If the sport you're playing, even within the sport, different positions have different demands that are put on their body. So, we try to put everything into a box because as surgeons, that's one of the first questions people ask us when they have an injury. okay, what's my recovery timeline? That's probably the number one question people ask. And so, you have to be fairly nebulous because it's variable. So everyone's body responds differently to surgery, and everyone's demands once they recover are different. So it's hard to kind of put that into a nice little box where we could say, all right, at 6 months and 3 days, you're going to feel 100%, right? It's just hard to do that. So if you look at an Achilles, like what I counsel my patients when they have an Achilles rupture, we generally aren't looking at any real explosive sporting type activity for a minimum of 6 to 9 months. So when you see recovery sooner than that, that's beyond the exception. That's why when I was chuckling when Rogers was talking about coming back at 2 and 3 months, like some ridiculous. It's like that's just so outside the normal. I'm like, that's not a thing, right? So I never took his comment seriously. But if you look at someone who's saying, I would really want to push it and maybe get back to the beginning of next season, so could Tatum be back at the beginning of the next basketball season? It's possible. I suspect he'll miss a little bit of it. The thing is you just don't want to rush it too much and have a re-injury. And it's not necessarily just the Achilles that they can re-injure. The rest of the leg is going to be deconditioned. And so then you run the risk of an injury to some other structure, knee injury, hip injury, anything on that extremity because it's shut down for a while. So I think a realistic time frame would probably be 8-9 months. That's pretty realistic. Durant's, I do remember going over a year, and I'm not sure why that was. I don't know if he had a complication or an issue. That is definitely longer than the average one by a reasonable stretch. But at the end of the day, you really want to look at getting the athlete back safely, and so there must have been something that was holding them back.
Yeah, man, it's weird. So like when we talk about these players or athletes or maybe some of your patients, if you've noticed like, hey, they're healing really fast or, they're kind of expediting the timeline, does that make you a little bit nervous to clear them right away because it's so outside the norm or not really just because, you're seeing the results firsthand?
Yeah, it's a challenge. Some injuries like ACLs, for example, have just excellent literature that says you return before 6 months and there's a significant increase in risk of re-ruptures. And so what we can see, let's say, again, using ACL as an example, you can see how the knee looks, you can see the amount of swelling, you can see how the muscles rebounding, all those things, range of motion, how the graft feels. Those are all things that we can visibly see and even get some objective data on as far as strength and symmetry and strength. But the problem is we know that the ACL graft, for example, isn't fully strengthened. So it undergoes a process called ligamentization. And so it's not as strong as it normally would be. So when you look at it in that regard, the athlete may feel like I am ready to go, but we know that they have a higher re-tear rate. So there's sometimes you have to actually tell the patient, I know you feel great, I know you look great, I know you're chomping at the bit, but trust me, going back now, we have an increased risk of an injury. So there are times where you have to pull them back. And, there's a lot of different kinds of patients out there, but athletes, both the good and the bad of taking care of them is they are very, very dedicated to getting back. And so sometimes that means saying, look, you need to dial it back a bit, which is a hard discussion to have because a lot of times those athletes have really pushed themselves hard in rehab and therapy to get to that point. And so they kind of feel like they're being cheated a little bit, but I'm telling them, like, look, I'm doing this out of your own best interest. Like I'm not holding you back to be mean. I'm holding you back because we don't want to be sitting here talking about how you retore your ACL because that is not a fun discussion to have.
Yeah, no kidding. Hey, I want to ask you this. In the first hour, we were kind of talking a little bit about position coaches and in terms of like, in Green Bay and such, with whether it's the Packers defensive line coach maybe under the most pressure, trying to get, the most out of their defensive line and such. And we had somebody chime in and say, don't forget to put a little pressure on the training staff, still too many preventable injuries, which I'm like, so I looked at it. Green Bay was the 7th least injured team based off metrics last year, but the whole preventable injury part, I kind of like cringe at that. I don't know if it's because I've gotten to know you over the years and such and learning a little bit more. That kind of seems like, is that really even a thing, a preventable injury, like maybe soft tissue injuries or such?
Yeah, I think that there is a slight thing. Like we talked about, like, when you look at the injuries, like is injury prone, right? That term we've used before. I'm not a huge believer in that. I think there are certain things that can become recurrent, like a knee injury with a cartilage problem. That's going to be now a recurrent problem. But to be like, oh, you pulled a hamstring and then you broke your wrist, and then it's like those are just different things in different circumstances. So, but to your point, if you had a team that's having a lot of tendon-based issues, is that something that is this a situation that their workout regimen and things like that are playing a role? I think that there's some validity to that. So, if you have a team that's just having, hammy, groin, calf, like all these muscle and tendon injuries, you could look at the way the training's being done, or not only that, like the kind of the recovery phase as well. So there could be something to that, but unless you're an extreme outlier, there's always going to be variability, right? So if you follow any team, one year they're going to have a handful, and when you have a 53-man roster, it doesn't take many injuries to all of a sudden put you one way or the other. So like 1 or 2 extra hamstring injuries, all of a sudden you're the team with the most. You have 1 or 2 less, and you may be the team with the least, right? So it's just a small sample size. So I realize I'm kind of dancing around the answer. I think there is a little bit of truth in some of that, but for the most part, I think it just there's flukes, and there's just things. And on top of it, take one step further, a lot of these athletes are doing a lot of their training on their own. So their off-season regimens, they have their own training staff, their own dietitians. I mean, these guys spend literally, hundreds of thousands, if not millions of dollars in their career to optimize their body, and a lot of that's done on their own. So it's hard to plan it squarely on the training staff, but there's some element of responsibility there too.
You make a good point too, because I mean, with the lack of time that these players have in the building now, because that's what they wanted with the CBA negotiations over the years. Coaches want them in the building as much and such. But I think you make a good point, because a lot of these guys are off training on their own. They've got their facilities elsewhere and such. And is it potentially that could kind of not go with what team training staffs want them to do?
Oh, for sure. I mean, that's been a point of contention on teams in the past. And, I have one of my college roommates is the head strength conditioning coach for the Texans. And, he's told me in the past that they have times where, he has an idea on how they want to do the off-season workouts, and people's own training staff has a very different philosophy. And, at the end of the day, these athletes are kind of running their own show. That's just the way that it's churned out. So he said sometimes it is a struggle to try to get on the same page, because once they get in the season, then a lot of their training will be with the team, and it's going to be maybe a different philosophy or mindset. But he tries to work with the athletes and do what they want, because these guys are professionals and certainly are educated in some of those topics as well. So, but yeah, he said it can be a challenge trying to do that, where you're trying to, different techniques and philosophies may not always be on the same page. You can be at odds at times.
And could that be going to what you were saying a little bit earlier, too? These athletes are just bigger, faster, stronger? Because I feel like, we've talked about before, we never heard of ACL injuries or never heard of all these injuries back in the 60s and the 70s and all that. So, I mean, is it related possibly, too, that these guys are just bigger, stronger, faster, so they're putting more pressure on their bodies?
Yeah, I would say for sure. I mean, I think that you're going to look at it. I mean, you can look at it in football. You can look at throwing in baseball. I mean, to me, that's been the biggest explosion is shoulder and elbow injuries in baseball. And if you just look at the velocity that pitchers are throwing, I mean, that's something that you can objectively follow. And there's been a radical change. And not only that, it's just the younger age. I mean, you have high schoolers who are throwing at speeds that just were like almost MLB level previously. I mean, it's crazy. And so the human body has not evolved in decades. It just doesn't work that way. So it isn't like the UCL or the Tommy John ligament all of a sudden became 3 times stronger. So what happens? You get increase in UCL injuries or shoulder problems. And so, yeah, it's going to be one of those things that as the human body's pushed to the limit, sometimes the human body pushes back and is like, I can't do what you're asking me to do. And then you get, whether it's overuse injuries or acute injuries, fractures, torn ligaments, I mean, the list goes on and on. So, there's an element of that. But also, you look at what these guys are. I mean, they are the most prime specimens of what the human body can become. I mean, they are just Greek sculptures, right? So they do have themselves optimized. So, the nutrition status, the recovery, I mean, there are things that have allowed them to get to where they are. So that's not all negative, right? It's not all negative, but it does put more stress on the body for sure.
Mm-hmm. All right, before I let you go here, how do you like your T-Wolves' chances to get to the NBA Finals, whether it's the Nuggets or OKC that they got to play?
Yeah, I mean, it's with what we did at Golden State, them being short with Curry, it's hard to say. I mean, people are like, oh, they beat them without Curry. It's like, well, what were they supposed to do? They didn't have Curry.
Right, yeah.
They had a loss that had been bad. So, I mean, it's good to see. I mean, Randall's clearly stepping up his game and struggled a little bit, certainly in the first half of the last couple of games. But I think if we put it together, and I mean, we just play tough defense. Rudy Gobert, I think, is underrated. I realize that a lot of people think he isn't a great player. I think on the defensive end, he is just tough. I mean, he doesn't necessarily block every shot, but he affects so many. So I think we match up well with both Denver and OKC, but they're a great squad. So I think coming into this series, I thought I'd rather probably play Denver, but Jokic is really turning up his game right now, and so I don't know if I want to run the Nuggets either. But I think we have a fighting chance. I think if we play together, if Ant isn't playing at his top level, I think we're gonna have a hard time advancing. But that's why you're a superstar. So got to go out there and prove it. So I think it'll be a good series one way or the other, whichever team we match up with.
He's Dr. Austin Crowe, Chippewa Valley Orthopedics and Sports Medicine. Dude, appreciate the time as always, man. Enjoy the weekend, and we'll catch up with you again soon, okay, sir?
All right. Take care.